14 years since Kimberly Proctor was viciously tortured and killed, her family says they've yet to see change. Court heard how the two murderers, Kimberly's classmates, were ticking time bombs, both with a history of violence, before they carried out the unspeakable killing.
There still aren't measures in place to prevent this from happening. Obviously, it's still happening in every community, and we need to stop it. And when someone walks down the street, cannot walk down the street safely, we have an issue.
Her family has been pushing for Kimberly's Law, also known as the Self-Care Act, which would force at-risk kids with a history of violence, mental illness, or addiction into treatment before any harm is done to themselves or others.
What does it take? Does it take more people getting murdered? We don't want that. This is what we're trying to do, is prevent it from happening again.
Calls to reopen Riverview Hospital have grown louder since Wednesday's knife attacks in Vancouver.
How many more victims are we going to create until the government finally figures it out and reopens Riverview? I think it is that simple.
Going backward isn't the answer.
One expert says involuntary hospitalization for those suffering from addiction or mental illness has doubled in BC. What the province is lacking is community-based supports.
So our health system is making significant investments in helping people establish stability and the beginnings of wellness, only to release them into settings where they're almost doomed to fail.
Do all of it across the continuum care. That's why we're building out a system of mental health and addictions care. And it's absolutely, of course, unacceptable and terrible in the society when attacks like that happen.
Kimberly's Law was a way to honor the teen, and now the family sees it as one way to prevent deadly attacks. Angela Jung, Global News.